Okay. Anyhow, for today, we'll have a session. Let's have a minute silent prayer. Good evening and welcome to EduSkills OET Medici. Our mission is to make you fall in love with OET. If you're watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially and emotionally struggling to crack OET. And today we'll be looking into reading part C. This is not the regular batch session. This is based on certain clarifications asked by the aspirants. But then, however, it's useful for everybody. Let me share my screen. At YouTube comment space, just let me know if you can see my screen. Yes. Am I visible? Yes. My screen.
Visible, Father.
Yeah, not here at YouTube comment space. I want to respond because
In
sometimes.
YouTube, we can see it, Father.
Okay. So there was some doubt asked by Ruby, I believe, today. We'll have answer for it. Reading part C, absolute versus qualifying language. Okay. One of the easiest and simplest thing. This is for the advanced learners, but don't go to the shortcuts in the initial stage. You will never be successful. So initial stage, as I have taught you, you have to analyze the whole paragraph, text, whatever you do. So why language matters in OET part C is this. What are they testing? OET tests professional judgment, not memorization. However you practice, whatever you practice, they are testing in reading part C and listening part C, whether you have a ability to do the undertake professional judgment. Okay. Second one, correct answers always reflect clinical realism. So that's what I said. This is going to be very simple once you follow the strategies. This is exactly what is clinical realism, means what happens in the clinics or in the healthcare setting. Just exactly the same thing being asked here. Nothing special. And third point is extreme and rigid statements are rare in healthcare texts. Extreme, like all should do this. All patients can be cured with this medicine can never be stated. Or no one will benefit. Such extreme statements rarely exist or don't exist at all. They don't exist in the healthcare text. Fourth one, understanding language tone helps you eliminate distractors quickly. You should be able to understand the tone of the language. That's why we have taught you different types of text, nature of text, and how to do the analysis of the text. Okay. Common absolute words in the OET reading part C. What I'm doing today, I have never done certain things earlier in any of the sessions. This is based on some of the clarifications being asked. Okay. Common absolute words in OET reading part C are always, never, only, completely, entirely, all, and none. These are the common absolute words used. What does it mean? If there are 4 options, if you find these words, there are some more, but these are the common ones. If you find these words in any of the options, that option will never be the right answer. Okay? That option will never be the right answer. Always, never, only, completely, entirely, all, none. Thank you, Dorothy, for the super chat. And Jayabula, And the David is, yes. And what is qualifying language? So I am giving absolute language, okay? Because some are not able to digest what is absolute language, absolute expressions. This is the other side. I said whenever absolute words appear in an option, that option can be eliminated. Whereas what is qualifying language? That says this answer could be the right one. Okay. The other one says this is the wrong one. This qualifying language will tell you this is the most probable right answer. Okay. Qualifying language allows flexibility, judgment, and exceptions. Normally, in your right answer option, there will be flexibility in the statement. They will never say all must do this or all should adhere to medication. Those all will be adhering to medication. No. Judgment will be there. Exceptions will be there. Always there will be exceptions. Such answers will be the right answers. That's why we call them qualifying language. Common qualifying words in OET reading part C. What are the common words? This is the other side of absolutes. Okay. Other one I said will be wrong. If these words appear in any of the options, they will be right answers. Usually, often, may, can, most, generally, depends on. These are sometimes the synonyms or synonymous of these expressions, appear in most of the right answers. Okay. These are known as the qualifying words, are the other end of absolutes, other side of absolutes. Absolutes appear in any option that is normally generally a wrong option. And these words appearing in any option, that is the most probable right answer. In some cases also, the other option could be, is a qualifying word in some cases. That's what I said, there is flexibility when I say usually. When I say usually, there is a flexibility. Sometimes it may not be. Usually people are good. Often nurses are committed to their duty or to their profession. Often when I say, it doesn't mean 100%. It may happen. The patient may recover. No, health professionals will definitely, this patient will recover. No, he may recover soon. Can, modal verbs, will be dealing with it later. Can, may, could, all those things. Most, scale. Most of the nurses, health professionals are committed. That doesn't mean all are committed. If I say all of them are committed to their profession, you yourself will say that is wrong. That's extreme. So most is, there is a flexibility. The exceptions are allowed. Generally, depends on certain circumstances or conditions. Your diabetes will be under control provided you maintain keep your diet as well as maintain your physical fitness, all those things, and adhere to your medications. So depends on. In some cases, this particular medicine may not be effective. These are the qualifying words, which I have never taught so far because some find it a bit difficult to understand what is absolute. So I am trying to make it clear today. So examples of absolute options, usually correct or incorrect? Incorrect. Okay. Consent is always required in every situation. Always is absolute. So usually, if such expressions appear, always the word appears, that option will be wrong. Consent should be sought when appropriate. See, there is a flexibility. When it's an emergency, life and death issue, you may not get the consent. Okay, when appropriate. That is qualifying option, qualifying language. Often it is correct. Even when I say usually and often, you see, there is a medical tone. One of examples of absolute option, I said usually incorrect. That's not an extreme statement. often correct. Okay, there is a flexibility. And telehealth completely replaces face-to-face consultations. Now telehealth, online health care facilities, does it completely replace face-to-face consultations? No, that's going to be wrong. That is extreme. Telehealth can be useful, but not in all situations. Can be useful. There is a flexibility. There's a flexibility. And all the adults never adhere to medication plans. It's a categorical statement. Usually it is incorrect. If this tone or this type of language, absolute options or absolute language, appears in any of your answer options, they can be immediately eliminated. Okay, but don't believe me, you have to get it confirmed through your practice. The correct answer option could be medication adherence varies between individuals. Medication adherence varies between individuals. The other extreme could be complaints are only caused by medical errors. Complaints are only caused by medical errors is an extreme statement. There are so many other reasons why patients complain. Complaints often arise from communication issues. Often arise from communication issues. That means other issues also can be the reason for the patient complaint. Okay, so the left side are the absolutes. The red color highlights are the absolutes. These are the qualifying options or language on the right side. Okay, so absolute language.
Qualifying.
Absolute always. Qualifying is usually. Never absolute. Rarely qualifying.
Qualifying.
Only absolute. Mainly qualifying. Completely absolute. Largely qualifying. All patients absolute. Most patients qualifying. That's why I said you should have diary of these absolute words and qualifying words. Don't collect it from some list. Collect it only from your practice. Whenever you practice, there are 4 options in part C. You will find many of these expressions over there. As you go on practicing, you will have a list of these languages. Then immediately you can go to the options, and even without glancing at the text, you will find the right answers, at least for 40%. Rest, with that competency, when you go, other 60% is going to be very competent. Okay, if you like, just send me an emoji at YouTube comment space. If you love this teaching or this method, this is first ever. I'm trying to clarify more because never we had such chances to go elaborate. Because even today, Arubi, am I pronouncing your name correctly? Arubi, right? Arubi. You asked some question, and I'm coming to the same because many were asking the questions. So I have prepared some PPTs specially for that purpose. Okay, now elimination. And there are videos, about elimination, 7 skills of elimination, 7 types of elimination. Sorry, I lost my screen. I uploaded a video long back, elimination in OET Reading. Okay, in detail, I've explained the 7 skills. Today, we'll be looking just into 2. Okay. So, can somebody read this? Is it visible? I have made it smaller screen because I can't highlight otherwise. Is it visible?
Yes, Father.
Yeah, you
Yes,
can zoom
Father.
your phone screen.
Yes,
Okay, you
Father.
can zoom it, touch and zoom it. Yeah. I'll read the question later. You can read the paragraph. Yeah. What is identified as the most common cause of patient complaints? What are the hedging words? Hedging words means main words or the keywords. Your success in OET depends on your capacity to identify your competency in identifying the keywords or hedging words in the question stem and the answer options. This first line, what I read just now, is known as the question stem, and A, B, C, D are the 4 answer options. What is identified as the most common cause of patient complaints?
Most common cause.
Most common cause.
Most common cause.
Yeah, most common cause is the
Complaints.
hedging word.
Complaint.
Yeah, complaint is the
Patient complaint.
common topic. Yeah, subject. Let's see. Now coming to serious, for option A, serious clinical errors. Clinical errors. Okay. And communication problems and unmet expectations.
Communication problems.
Yeah, since there are two things, you'll have to highlight everything, right?
Yeah.
Yeah, because there is nothing in the small options. Sometimes only one words will be there. Option C, only failures in medical treatment.
Only absolute.
So what happens?
Eliminate.
Oh, you can eliminate. Yes. Don't believe these people. There are newcomers. Only by your practice, you have to get confirmed. Okay. And there's always staff negligence.
Absolute.
Eliminate.
Always.
Yes. And now the doubt from Ruby was this, right? Two options. Even in part B, two options are possible. Now you have to find the answer only from these two. Most common cause. Sometimes they can give common cause. That may not be the most common cause. So that's known as scale, which we'll learn later. Okay? Scale. All, most, majority, minority, some, or few. That will be the scale. We'll learn that. Okay. Can somebody just read? And as the person reads, just see, okay, which is the most common cause of patient complaints. Yes.
Managing patient complaints in healthcare. Patient complaints are an most important source of feedback for healthcare organizations and can contribute to service improvement when handled appropriately. Most complaints arise from communication breakdowns, unmet expectations, or delay in care rather than clinical incompetence.
Okay. Could you just stop 1 minute? 1 minute. Excuse me. Now, this is what we said. If you have highlighted most the scale, okay. If you have highlighted the most the scale, passage will have the most the scale. Then that tells you the answer is there.
Yeah. Complaints arise from
Yes,
communication
Father.
breakdown.
Complaints arise.
Yeah. Yeah. So here what is said? Most
Most complaints arise from
Complaints arise
from
communication
communication
breakdowns.
breakdowns.
arise from communication breakdown and unmet
Unmet
expectations or delays in care.
Delays in care.
So which is the option?
B.
B.
B, Father.
Yeah. That's what how we beat our enemy, you know. The time. The greatest enemy is time. Then do you require to read everything here?
No, Father.
No, Father.
And I'm not going to analyze it. You have to analyze as your task today. What is the type of nature of this paragraph?
Patient complaints. Cause and effect.
Cause and effect. Cause and effect. Now they said common cause of patient, most common cause of patient complaints. Here they say most complaints arise from communication break. So arise from common cause. Arise from means this is the reason. From this arise. Okay. This is made effect, and as I taught you in the cause and effect language. If you have not seen, you can go and watch that episode. They just put other side. Cause is put in this side. Effect is on the other side. So just change the order of cause and effect. Like I said, the example I gave was industrialization is the result of globalization. Globalization leads to industrialization. Industrialization is due to globalization. Global warming. Sorry, global warming. Global warming is the result of industrialization. Industrialization is due to
Global
warming.
Is it?
No.
Global warming is due to industrialization. That's the trick they play. That is the trick they play. They use different language options. I have explained in detail in that. Maybe 3-4 episodes. Examples I have given in 4 episodes. Okay, should we need to go further in this paragraph?
No.
Yeah. So this is as clear as that. Okay. Next one. Number 2, according to the text, that is very important. Okay. Sometimes you will have better knowledge. Don't use that knowledge, your knowledge. according to the text. All the answer must be according to the text given. There will be better answer or best answer as per your knowledge, but never go for it. If that option is not given in the text, even if it is the most 100% right answer, you are damn sure it about by your medical profession, but don't you choose it. Only what is right, correct according to the text. According to the text, which statement best reflects the use of telehealth in primary care? What are the hedging words?
Telehealth in primary care.
Best reflects.
Best reflects.
Telehealth.
Okay. Best reflects.
Best reflects telehealth.
Okay, so the telehealth in primary care is the subject, concept-based hedging word or keyword. Hedging words mean HEDGING. Hedging means main words or keywords. Best reflects is the differentiating word. Okay. Now, first option, telehealth is always appropriate for managing chronic conditions.
Absolute, always.
Absolute, always.
Yes, absolute.
Okay, absolute means
Chronic
what happens?
Eliminate.
Eliminate.
Okay, eliminated. Don't believe, okay, some people are shouting eliminate. That's why I'm as an obedient servant doing it. Others, beginners, and don't believe them. Okay, only you read, understand, then you eliminate. Okay. Second one, option B, telehealth can be useful, but is not suitable for all situations.
All is eliminate.
Not eliminate.
Suitable for all.
Because there is not
Not,
suitable for
sorry,
all
Father, this is not
situations.
absolute. This is not absolute.
Absolute.
For all
Possible
situations.
answer.
This is not absolute.
Now, there are people fighting absolute and not absolute. Which is right now? Should I eliminate?
No,
No.
no.
Don't eliminate.
Yeah,
Father.
Not
This is
eliminate.
not absolute.
Not suitable for all situations
patients.
means,
Some
what is the
patients.
meaning?
Some
Some
patients.
are suitable for some
Suitable for suitable for some situations.
Situations.
This is one of the two exceptions I gave you. Whenever there is a negation, not no negative word used, most probably that is the right answer. That is the trick they play. Okay. Now let's see. Now telehealth completely replaces the need for physical examinations.
Absolute.
Completely.
Completely.
Completely is absolute.
Absolute. Okay. Completely is absolute. So people are saying this has to be
Eliminated.
I have no responsibility. Okay, you are saying it. Fourth one, option D. Telehealth should only be used when patients request it.
Absolute. Only.
Only.
Absolute. Eliminate.
So we got the answer.
And did you get the answer?
B is the answer.
Your
strategy is so great, Father.
Now, to prove this, I have already given you all the 5 tests from the OET website. I have applied these strategies in all the 5 reading tests to prove that this is right. I have applied the same strategies.
When we are, sorry to interrupt you.
Please, yeah.
When you are explaining, well, we understood that all the strategies, but when we are doing self, we will not get an exact answer. That is the main problem.
Yeah, the problem is like this.
Yeah.
Right.
It's happening with me, Father.
Yeah, do you know driving?
No.
Yeah, if you don't know the driving, you see, now you want to learn driving. Imagine that I'm a good driver. I can teach you driving. And I tell you this is steering. The only possibility is left or right. Two side movements. You can turn the vehicle. Other 5 or 6 gears I told you, these are the gears. And this is the reverse gear. If you apply this gear, the vehicle will go front. And first gear, second gear, third gear. Then you have clutch, accelerator, and brake. You understood everything. And I asked you repeatedly, which is clutch? You said this. Then I tried to confuse you. Then you said, this is clutch. Can you drive?
No.
Yes, Father, I can.
You can't drive, Ma. You can't drive, Ma. Ambulance will have to be immediately called if you drive. Okay? It will take time. We have to slowly start. As you start the vehicle, as you leave the clutch, the vehicle will stop. then again
I
you have
am
to try.
driving,
But
Father.
Acha, I'm fan of your YouTube videos
Okay.
since 2023. Then I
Okay.
had exam last July.
Okay.
I follow your all strategies. But
Okay.
during the exam time, I have come the speaking and writing good score. But the
Okay.
problem I listening and reading I got
Yeah.
300 only.
Yeah.
So really then.
Yeah, OET has never stated anywhere a fan of Father Saleen or Edu Skills International will be getting high scores. Okay, first statement. Okay, so being a fan will never help you. Okay, being a fan will help you to fall in love with OET learning process. Again, I can challenge you. You haven't practiced as per the guidelines. If you have practiced, we have hundreds and thousands of people since a decade who have passed in the first attempt with more than 400 scores. And you have a lot of testimonies in the YouTube channel. If you have practiced as per the guidelines, just watching videos will never help you.
Okay.
Watching videos is just getting the knowledge. Now, attending class will not help you in itself. That's only a knowledge, only the knowledge I am imparting. But you are tested of your skill, reading skill, not knowledge. Reading skill, writing skill, speaking skills, and listening skill.
Father,
Yeah,
Father,
yeah.
how we can get the material, Father? Actually, I tried to be online and I downloaded the
Yeah.
app also, but I
No,
couldn't
no.
get any material from there.
Yeah, the thing is if you go to what you call
Main platform.
main
there is-
platform, in the file segment, you have enough and most free materials available. So reading, you can directly download. Listening, you will have to download one script. If you want the script, you have to download script from the file segment and audio from the media segment. But the same
Sir,
date. If you see the date, same date, those things will be there. Date-wise, you
sir,
can download.
Father,
Yes.
are you talking about Telegram? I don't know
Telegram,
which
main
is
Telegram.
Main Telegram.
EduSkills International main platform, where there are nearly 38,000 aspirants.
I will see,
EduSkills
Father, but I
International.
couldn't see.
There, if you click on the name of the Telegram group, you will find
There is-
options like media, music, all those things. In the files, if you click, you will find all the materials.
I will try, Father, today.
Yeah,
I
yeah.
will see.
And
Have a
that's
look.
why you have to ask these questions in the main platform. Admins are assisting you, and so many people will assist you and tell you what you have to do.
Sir,
And
I could not get the reply, Father. I asked the question how I can get the material, but I could not get any reply from the main platform.
you'll have to ask
Telegram.
again, because when you ask maybe midnight, they will not be able to see it. But then most of the time they answer. Not only that, if you watch all my episodes from episode 1, they are all small videos, 3 minutes, 5 minutes. I have made one session into 15 videos so that at least you watch small videos. That gives you clarification about everything, all your questions. This is the
Okay,
28th episode I have published. So I'm going on publishing systematically on request. And we are also working on a ebook, but we are not able to, with some contributions, we are not able to bear the expenses as of now. So we could not complete. We have done a portion of it, like all the official website materials we have made into a book. Rest we'll be adding as early as possible. Okay, now let's read this because sorry. Power failed. I don't know. I may be disconnected. Okay, if I get the power again, it will be cool. Otherwise, anytime I can be disconnected. If you can discuss something. Meantime, if the power comes back, I will join. But until then, you can keep discussing. If at all, I go out immediately. Okay, because my backup is for a couple of minutes. My net will be disconnected. That's why, without power. So somebody can read this. Let's see, because what I'm saying. Okay. Yes, power is back. So you are lucky. Yes, smile. Can you see me?
Yes, Father.
Yes, Father. Yes, Father.
Yes.
Okay. Now, see, now I am focusing only one particular tip or strategy. One text will have 5 to 7 strategies. one text will have 5 to 7 strategies. You can apply any one or two. You want to confirm, you can apply the second one. Now let's read this to see which, if anybody can identify another strategy where you can immediately locate the answer, so that the beginners who are convinced that we have not simply eliminated, that is the right answer. Let's confirm it. Let's read, and somebody finds the answer, you can shout, okay? Any other clue? Immediately you can shout when everybody shouts. When somebody shouts, you can stop reading. Read.
However, the telehealth is not suitable.
Okay.
Father, I think the answer is
Telehealth
B.
consultation have telehealth consultation in primary care. Telehealth consultation have become an important component of primary care, particularly for patients with stable chronic conditions. They allow clinicians to monitor symptoms, review test results, and provide follow-up advice without requiring in-person visits. However, telehealth is not suitable for all clinical situations.
B is
Patients
the answer.
presenting with new
Yeah, objection is there. You have to stop.
B is the answer. Telehealth is not suitable for all clinical.
Yeah. So the next clue, second clue, I am not giving you all the clues so
contrast
that
word.
beginners will not be confused. Second clue in the same text. Whenever there is a contrast word, answer will be immediately after the contrast word. Sometimes there will be two contrast words. The answer will be after the second contrast word. Now, do you see the answer after the contrast word?
Yes.
Yeah.
Yes, Father.
Yeah. Similar to what? Telehealth can be useful, but it's not suitable for all. Telehealth is not suitable for all clinical situations. So that is confirmed. But without coming to the text, we got the answer. That's why we did not come. Right?
Yeah.
Then how can you complain? There is no time. We find it very hard to complete. I could not complete. I had to rush. You can dance and complete because you don't read at all. Once you know the strategies, most of the things you don't even read. Even if you read, you'll be reading topic sentence, one sentence or two sentences. Or you'll be simply skimming and finding the contrast word within fraction of seconds. That's great. Okay. So this is it.
I want to ask a question.
Yeah.
The question B that is correct, we have contrast word, absolute word inside, and then a flexible word inside. So
where is it?
Within the answer that we choose as B.
Yeah, that's what I explained in the initial state itself. What is the meaning? Two exceptions are this. Absolute strategy cannot be applied when the meaning of the option is not absolute, and when it is an opinion of someone. Two exceptions are: one, meaning must be absolute. If meaning is not absolute, you cannot eliminate. Second one, opinion can be absolute. Opinion can say, you can say, oh, maybe you fought against a doctor or someone else, then you say all the doctors are very bad. That's your opinion, not the fact. Okay, so that cannot be eliminated. Here you see, what I was saying is second option has a absolute, but these people are shouting, no, that is not absolute, that is not absolute, that is not absolute. Now answer her. She is saying that is an absolute. How do you say that is the right answer? Who will explain?
See, there is it is saying that not suitable for all situation means the meaning is suitable for some situation. The meaning is not absolute.
Yeah,
so
some
not
is not absolute,
suitable
right?
means not.
Some
Yes.
is not absolute. Not suitable
Not
for
absolute.
all situation means suitable for some
Suitable
situation.
for some situation.
Or suitable for most of the situations or some situations. None of these are absolutes. I'll come to that. I'll show you a slide with these expressions. If you are a beginner, you will understand. Don't worry, you did not understand all the. That's why I'm not going to explain any more strategies. There are more strategies in this paragraph. There are more than 5, 6 strategies in this paragraph. I don't want to explain now. But same paragraph I will take, text I will explain other strategies. Now, since I just wanted to show you this is the right answer, where is the answer? So whenever there is a contrast word, answer will be soon after that contrast word. If there are two contrast words in the same text, normally the answer will be after the second contrast word. Okay?
Okay.
Yes.
Thank you, sir.
Welcome. Yeah, let's try this one. The question 3, what does the text suggest about medication adherence in older adults?
Suggestion.
Suggest, okay.
Suggest
Medication adherence.
medication adherence.
Medication adherence.
Old adults.
Older adults.
Older adults, okay. Then, sorry. One sec. Give me 1 sec. Okay. Option A, older adults always struggle to follow medications instructions.
Absolute.
Absolute.
Always absolute.
Always absolute one.
Medication.
I don't know, but I am just eliminating since you said it is absolute. Once you say absolute, I can't but eliminate. Okay, smile. Next one, option C. Option B, medication adherence depends on individual circumstances.
Depends
Individual
on
answer option flexible.
individual circumstances.
Individual
Depends.
circumstances.
on individual
circumstances.
Okay. Then option C, family involvement completely solves adherence problems.
Completely absolute.
And you see, that's what I said, these are real medical situations. Family involvement will never completely solve adherence problems, right? No, because it can never. There are so many incidents where family people are so collaborative or cooperative, but then you cannot be sure of medication adherence in older adults. D, even if you give the medication, they will keep under the tongue, and when you move away, they will spit out, right? Some people? Yes. So family involvement completely cannot solve. So that's what I said. All these statements, as per your medical knowledge or your professional knowledge, they are wrong. You not read anything. Yes. Healthcare professionals, option D, healthcare professionals should never question adherence in older adult patients. Older patients. Never.
Absolute.
Okay. So that healthcare professionals should never question adherence in older patients. Can you say that statement?
No.
Then definitely healthcare questions should answer question, right? They should be concerned about the medical adherence. Yes. So what is the answer?
B.
Yes. Where do you have that? Yeah, where do you have the answer? Fast. I'll give you 30 seconds to find the answer. Read fast by yourself in silence.
Last line.
Last line.
Healthcare
professionals should.
After the contrast word.
After the contrast word, however, it cannot be assumed that all adults struggle with adherence, as many manage their medications effectively. Healthcare professionals should therefore assess adherence on an individual basis rather than relying on age-related assumptions.
Last line. Healthcare professionals should.
Yes.
It should be the first line proficient by several factors. Is it not correct, sir? Father?
Which one? Yeah, medication adherence among older adults.
Sentence also, Father.
Yeah, that's what I said.
The topic sentence also says.
Yeah, I am not. You are right, but then I am not stressing all the strategies here. Medication adherence among older adults is influenced by several factors itself is the topic sentence, so that gives the answer if you have competence in that strategy. Okay? That has the meaning of second option, right? Same thing, if you remember the paragraph structure, second structure. In the conclusion, same thing is repeated, paraphrased. So this is also topic sentence based. You can have a clue there. Or should, suggestion is should here. Okay, suggestion, if you have competence in modal verbs, you know, suggest should have a modal verb, and should is suggestion. If you don't know, don't confuse. Okay, we'll be teaching you that. Should is suggestion. Must is mandatory. Should is suggestion or recommendation. Must is mandatory or compulsory. All those things. And that's why I said I'm not explaining all the strategies now so that I don't confuse the beginners. Those who know, definitely you know. Even the contrast word is there. So answer will never be before that contrast word. But in the topic sentence, you have a taste of that answer if you have competency. Okay, cool. Do you have some more stamina to go on?
Yes,
Yeah.
Yes, sir.
Yes.
Okay.
Thank you.
Okay. Now eliminate the extremes. Since somebody was not clear about it, I'll show you the extremes. Okay. See, always, often, most of the time, sometimes, seldom, rarely, never. Okay. So eliminate always and never. If those expressions appear, always means 100%, never means 0%. Extreme poles of a scale. This is known as scale. Okay. Scale means always is not often. Often is not most of the time. Most of the time is not sometimes. Sometimes is not seldom. Seldom is not rarely. Rarely is not never. Okay. Like boiled water is not hot water. Hot water is not warm water. Warm water is not cold water. Okay. Hot, boiled, hot, warm, cold. Eliminate those extremes. Or else all, most,
majority,
many, a few,
few.
few. A few means some. Few means there are few students. There are few OET students who are interested in learning. What does it mean?
Zero student. No.
Zero. There are no students. There are no students. A few means some, but if you say there are few students in the classroom, there are no students in the classroom. There is little water in the well means there is little
No
water.
water.
There is no water. No water. Okay, these are the tricks they will play. Okay, eliminate all and few if they appear in any of the answer options. Immediately that can be eliminated. And I have explained all the 5 official materials from OET website where you have all these strategies applied. And you will find in part B so many of the absolutes. Even a good number of the questions you have 2 absolutes as RUB said, and immediately you have the answer option ready. When you have part B, 2 options have absolute expressions, so third one is the right answer. Okay. Yes, common absolute words in OET reading part C, always, never, only. We have seen that completely, entirely, all. None. Elimination absolutes. Let's see. Eliminate the absolute. Okay. Avoid north-south options. Means extreme values. They are the absolutes. They can be eliminated. Search for clues. Words like, as I already said, never, all, every, always, none, all those things. Okay. My system is slow. Yes. Yeah, my system is going slow. Okay. We have already seen this. Search for these clues. OET reading principles of elimination. Okay, you can eliminate absolutes. We have seen what are absolutes. The other one is 7 principles I have taught you. Here we are looking into 2. Second one is quite opposites. Okay, if there are 2 options, among 4 options, 2 are quite opposites. What happens?
The other two.
The other 2, not those opposites. The other two will be automatically eliminated.
Yes.
If 2 options are opposite, other 2 will be eliminated, and one of these opposites must be the right answer.
Yes.
Yeah. So Just to give clarity, since some are asking all.
Most.
There could be any other scales in between, okay, but we are trying to tell you some idea. 100%, all means 100. 90, it can, most can be 80, 90 plus or anything, okay, but then it should be most. Majority means anything more than 50%, right? Minority means anything below
less than 50.
A few means 1 plus anything. Some means more than 1. Few means 0. But 100 and 0 is particularly pakka. There is no flexibility, right? 100 is 100. All means 100%. Few means 0%. But all other options, most of them means it can be 86 out of 100 or 80. Even 70 out of 100 is most. And majority means anything above 50. Minority means anything below 50. A few means 1 plus anything. So there is flexibility in all the options, but extreme options 100 and 0, it is exactly 100 and exactly 0. That's why they are called as absolutes. Exception to the principle of absolute. This is what somebody was asking. I know you're beginners, otherwise you won't ask. Meaning of the sentence option is not absolute. We have already seen, right? Not suitable for all situations means suitable for some situations. So meaning of the sentence or the answer option must be absolute to eliminate. If the meaning is not absolute, you cannot eliminate because there is the absolute word. No, all are not committed. All are not committed means some are committed, or majority are committed, or most are committed. Okay, all is there, but all doesn't mean all. Opinions. When they are asking opinion questions, absolute words cannot be eliminated because somebody is saying their opinion need not be right. You need not accept it. Okay. Exception 1, the meaning of the sentence option is not absolute.
Absolute.
Yeah. Exception 2, opinion. Let's see one. Reduce. Yeah. Philippe Joel's comments in the first paragraph indicate that he believes. What are the headings? Edging words.
In the name.
Name.
Names.
Yes.
And first paragraph. And believes.
First paragraph for beginners. This tells you in which paragraph it is. So you have to number the paragraph. As soon as you get the material, you have to number the paragraph before you start something. And believes. Believes means, what does it mean? Believes means?
Opinion.
Opinion. Sorry. I'm sorry. I'm waiting for my screen to appear. Yes, there was some problem with it. Yeah. Yeah, I can give you 1 minute to grab some juice or tea or coffee, something and drink because you need some mental presence. We are going to learn something very, very important. Okay, now we are not going to look into the name. Okay, name already I have uploaded the episode. If there is a name, go to that name and immediately find the answer. Okay, take 1 minute, grab something, some snacks or something and eat and smile. Okay, you have 2 minutes. You can just rush and get something. You need some rejuvenation. And only when I see your smile, I will start again after your snacks or juice. Only once you come back and I'll say yes in the comment space, I will start. Don't worry. 2 minutes. Then you have more stamina. Shahzad, you are not getting anything. Jaya, Shahzad. Libby has got something. Yes.
According to recent study, what
Hello, Father. The previous Before this one, I didn't.
Yeah, if you have something you can discuss now until they come back with after the refreshment. 1 minute. If you have anything to ask, you can ask me.
Hello, Father.
Yeah, please.
So the previous screen, I did not get the previous screen before this one that stated exceptional. Those exception ideas, I did not get it. Please, can you go back to the screen so that I can get it and screenshot?
You mean this one?
No, screenshot, it will be Father.
Thank
This
you.
one?
Yes,
Yeah,
sir.
screenshots, those who have taken screenshots, they will share it in the main platform. Don't worry about it. If you miss something. Yes. And
Hello, Father, please, is the class being recorded?
Yeah, it will be record.
Okay, thank
You
you.
can see also.
Are we recording here in Zoom? No, right? Forgot to click record button, I believe.
Check that. Look at it, getting a plug. And breaking it down. Can you click on it? I will the face is wrong. There you go.
And better than seeing the screenshots, the best option is go back and see the recording and try to take the material and do the analysis perfectly. And I said, normally I tell you, it's not important to get the answers or the score in the initial stages. Don't worry, only during mock test you need to bother about your score and timing. As of now, you can just keep practicing. Okay. Once you reach just at the YouTube comment space, say yes or something, some heart. Okay. Yes, Linear Varghese is ready. Yes, Jenshi is ready. Yes. Sini Abraham, thank you for the super chat. Vali Prabhakar, yes, thank you for the super chat. Dorothy David, thank you for the super chat. Yes. Yes. Mouse is ready. How about others? Ready, yes, ready. Vali Prabhakar, Jomon, ready, yes. We can start. This is Ramanujam, yes. Sini Varghese, ready. Yes. So if you have followed my previous sessions uploaded, definitely watch those. And at the comment space, at least mention what you feel about it. If you have a doubt, if you have a concern. Today's session is basically because, like Ayubi asked, there were many doubts in the comment space, in the YouTube comment space. I collected them and I took up some materials and created PPTs to clarify those doubts. That's how you learn. Otherwise, we don't know whether you have understood or misunderstood. So at least mention at least one sentence. How was it? What did you learn? In the comment space, also in the main platform, so that everybody get connected each other. That's how you improve. Then there will be more people. If you activate others, there will be more people. Then we'll be able to go on with the session. Okay. Now, if you know the name, I'm not going to deal with it too much because you have studied it. You have to immediately what you have to do when there is a name.
Go to We'll find out the name.
Go to the name.
Yeah, where is the name now?
Third
Just search for
line.
this
Third
Philippine
line.
region.
Philippine.
Okay, where is it?
In the
Yeah,
third
Philippine.
line.
Okay, Philippine. Your
In
name
the
is
third
there.
sentence.
Yeah. And again, where do you have the name?
According to
Hijol says
Joel
opinion. Okay, Hijol says if you have anything, even contrast word, second one is important. If there is name referred many times, the second reference or the last reference will be most important. Now let's see the options. So there are many other things, right? Here you see cavities according to recent study. We are not bothered about recent study. They are asking the opinion of Philippe Hejo. So recent study, we don't want to know what is recent study. Okay, you says lead researcher. Now PhD, and what is this? PhD, professor, university, all those things. These are
We
known as
still-
the subject
Father, please
complement.
excuse me. The name is still in the third to last line.
Yeah. Where is it?
The third to
according
last
to
line.
Pujet.
Okay. Yeah. Okay.
Yes,
He says.
Says.
I think there is some typing mistake. Okay. He is there. Name is not there. Sorry. There is a typing mistake. Must be a copying mistake. I feel
Okay.
so. Because
Okay.
according to, sorry, name is there. Sorry, that name is
sir.
there. That was my mistake. I could not read it.
Control Z.
Okay. One sec. I'll correct it. Okay, ignore. Yes. Copy. Yeah, you're right, Ma. Name is there. According to my
Sorry,
system is
Father,
very
if you
slow.
put this Control Z, it will come automatically.
No, that's my system is very slow. When I'm screen sharing, there is some problem. Is that right?
Yes. But you deleted
Yes, sir.
some words.
Yes, Father.
There is some evidence. There delete.
Okay. Right. Full stop. There. My system is very, very slow. Takes a lot
There
of time.
is.
There is some.
Yes.
And above the line there is he says.
Yes. One sec, I am coming back. Yes. He says, yeah. Does it refer to? Let's check. Yeah. Now, coming from here, recent study, we are not bothered. Dental professionals. For years, dental professionals have debated the importance of clean tooth versus the sound tooth hypothesis in preventing cavities. Those in the first camp, we are not bothered about first camp. Those in the first camp, these are the opinions of different groups. You understand? Okay, we are not bothered about those. That's what I'm saying. When there is a name, don't worry about other things. The names of other people, only that person, or that, don't worry about other groups. Others argue. We are not bothered about others' argument. All this tells you, you can simply ignore those aspects. Come to that name. It's okay. That was explained. Now let's go to the answer. When we come to the answer, you will understand. Now, option A, no one knows how to prevent plague. What are the hedging words?
Prevent plague.
Prevent plague.
No one knows.
No one knows.
No one. No one. What is no one?
Nobody.
Prevent plague.
That is absolute.
Absolute.
Can you eliminate absolute?
No, this is
No.
Because beliefs tells you
Beliefs.
this is an opinion. So you cannot eliminate absolute. But there are many other friends who will help you. One is name, we have already seen. Second one, everyone has plague on their team.
Everyone.
Is again absolute.
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 Can you eliminate? No.
No.
This is a opinion question. Only fluoride can. Only. Again absolute. Only fluoride can remove plaque. Why I'm showing this? Because in the YouTube comment space, there are comments saying that, Father, this has got, or they have sent me saying that this is absolute and that is the right answer. But you said absolute is wrong answer. So when you're asking me again, showing some absolutes. Plaque is impossible to remove. Impossible is
Difficult. Yeah.
absolute.
Absolute.
All the four options has absolute. Okay. Now here you see, only fluoride can remove and impossible to remove.
Opposite.
Two opposite.
Opposite. Can remove, impossible to remove.
Two opposite means others two we can eliminate immediately.
Yes.
Yes, I'm trying to highlight it one second. So these are two opposites. So principle says immediately you can eliminate eliminate the other two. Sorry. Eliminate the other two. Because once you have two opposites among four options, the other two will be definitely wrong. Don't believe us, okay? Learn it from your practice. So you have to find from only these two. What does he say? Philippe goes, can remove or impossible to remove? Cannot remove.
B.
Yes.
Impossible to remove.
Now go to the name and find. Go to the name and find whether he says can remove or impossible to remove. May not be the exact words there. You will have synonymous meaning, same meaning, synonymous expressions.
The plaque is inaccessible.
When there are a repetition of names, don't go to the first one.
plaque is inaccessible
The plaque is
and you
inaccessible.
can't get to the
Okay,
it.
the plaque is
Says
inaccessible and you can't get to it means you cannot remove it. If you can't get to it, how will you remove? Right? That is with the name.
No.
Yeah, he says.
He says.
Hijol says.
Okay. Hijol says. That is one.
Hijol says.
Yes, Hijol says. Okay. What I'm saying, there are many, at least 5+ strategies you can apply on the same text. First, we have applied name to make it easier. Now, before applying the name, you can apply opposites, eliminate other two. Then you have less work to find out. You just find out Philippe Hijol says, can remove or cannot remove. That's all. Then he says, the plaque is inaccessible and you can't get to it, which means you cannot remove.
Yes.
Yes.
D is the answer.
D is the answer.
Okay.
Yeah.
D is the answer. So you want to highlight here. D is the answer. I'm not going into details because I will explain this once. The video is there. That's why. Okay. Yes. See, 4 absolutes are there in all the 4 options, but the word believes and the name says they are asking for an opinion. When they are asking for an opinion, you cannot think of absolute elimination. Okay. I'm just showing you this one video is there about these 7 skills. We have taken only 4. I'm just showing those 7 skills of elimination. I'm not going to explain it now. That will confuse. See, eliminate the absolute that we have taken. Eliminate the wrong ones we have not taken. Look for precise language we have not taken. Straight opposites. First and fourth one we have looked into. Other things are repeatedly explained. That's why I'm not doing it now. Radical answers incorrect, educated guess, and random guess. Okay. Random guess means you can decide if you don't get answer for 6 questions. Okay. By all means, you did not get answer for 6 questions. You can decide which must be the answer soon after your breakfast in that morning after 8 minutes. After 8 minutes of your that day morning breakfast, you can decide an answer. and most probably you'll be right. I have explained in that video. Even before going to the examination hall, you can have a random guess for those questions. If you never get the answer, you will never have such a situation if you go strategically, but they're just telling you. The whole video is there. Based on this, I have explained. Okay, rock breaks scissors, a practical guide to outgoing and outwitting almost everybody. This is the most authentic book about what? About this multiple choice questions. He had done a research on 24,000 different MCQs of international exams. I have given a link there. It's live in the YouTube comment space. You can find if you want to read more. This book explains everything. This link you can click and you can find a free ebook. If at all you have more time to read. Not required for exam purpose. I have all the explanations done. Okay. Do you have some more stamina?
Yes.
Yes.
Now I'm going to take one material in sequence. Okay. You can find how many absolutes are there just to see. Okay. Now, what does the manual? There is some distraction. Okay, please. There is some instrument which is distracting. Please mute, please. Please mute. Yeah. When you're interacting, if you have distractions in the room where you're sitting, please don't interact. Okay. If you have no interactions, please, no distractions at the background, you can interact. So what does the policy for manual handling equipment tell employers? What are the hedging words?
Manual handling.
Policy.
Okay, policy is there. Manual equipment telling employers. Okay, this is a policy. I have taught you different types of text appearing. What are the nature of the text? I have explained in previous sessions. You can understand from there. Okay, first one, option A. All areas of the hospital should be fitted with overhead tracking.
All
areas.
All absolute.
All absolute. So that will be eliminated. Okay. Option B. Assistance devices should be used over physically handling the patient. What are the hedging words?
Physically handling patient.
Yeah, this common as device, right? Should be used over physically handling the patient. Okay. Option C, patients have the final decision on how they should be assisted.
Final decision.
Normally, do you agree with this as a health professional?
No.
Yeah, then why should you search for answers then? If you don't agree with it, I eliminate it. I don't know. I'm not a health professional. I'm not a health professional. Since you said, I eliminate it. You know, categorically, you cannot say always patients. You do every treatment as per a patient's wish and whim. Can you say that? No. Yeah. So that's so assistance devices should be used over physically handling the patient. One more strategy I'm telling you. Now, what are they asking? What does the policy for manual handling equipment tell employers? Telling about what? Manual handling equipment. That is the concept, right? Here, what is the concept? All areas. Here, assistant devices is similar to manual handling equipment. Here the concept is patients. That's why I taught you concept-based hedging words and differentiating hedging words. In that way also, first and third cannot be right?
Yes, Father.
Yeah. So the third option speaks about the opinion of the patients, but they are asking, what does the policy tell the employers about this particular instrument, device?
Yes.
Okay. Okay. Yeah, you can just read so that we will finalize. We have not read anything. We have just said, you said third option is not right. Because, you know, being a health professional, I don't know. So let's confirm. Just read this, yeah.
Policy for manual handling equipment. The provision of ceiling, hoist technology, and air-assisted patient lifting equipment should be considered as the first-line handling aid by employers, as significant evidence exists that their use reduces operator and patient injuries. Overhead tracking should be installed in all new and refurnished facilities. This should cover beds as a minimum, but should extend to in suites and other areas of the facility where patients are likely to require assistance. Once, as an assessment has been made that equipment should be used for safe patient handling, then equipment should be made available and used even in situation where the patient is for it not to be used.
Yes. Should we? Where is the answer?
Last.
Yeah, once an assessment has been made, the equipment should be used for safe patient handling. Then equipment should be made available and used even in situations where the patient or his family preference is
Not to be
for it not to be used. Even if the patient says not to be used, you have to use it. That says against third option, right?
Yes, Father.
And this is the third option. Now this option, this answer, where do you have? Assistant device should be used or physically handling the patient.
The first line
topic sentence. Topic sentence is the first line handling aid by employers. First line handling means, yeah. That is the topic sentence says should be used. That is the first line handling aid by employers. Factual statement, categorical statement. Means you have to use it as first line. Then they say this should be installed in all new or refurbished facilities. Does it mean all facilities there is installation? No. Only new and refurbished. Same technique they will ask you, okay? They will ask you, there is another type of question, that's why I highlighted it. All new or refurbished facilities. Then you will feel that is right. There is another technique, I'll come to that. Now it is clear, no? We have not read anything, but then topic sentence itself says, this is the answer. And patients, this one, last option says patient, even if patients, third option, right? Even if patients object, you must use it. So they don't have the final decision, right? So answer B is right. Do you agree?
Yes, Father.
Yes,
But
Father.
we have confirmed it even without going to the
Reading.
text.
Yes.
Such easy questions. Reading is only for, I tell you, once you are competent, you just answer and go. If you have any doubt, keep a tick mark and go, then revisit. You will have a lot of time to revisit and confirm. Okay, in the first one, definitely don't go to read the details. Okay. So should we consider the first line? Handling.
The first
There
line.
use reduce, operate. Yeah.
Yeah, I said the first line.
Yeah, first line means main. Yeah. And again, it is repeated once an assessment has been made that equipment should be used for safe patient handling. Repeated again. Should be made available and used repeatedly. You don't require all those things. You don't understand. Must be used. Then an exception is given. Even when there is object, patient's object, it must be used. Is that cool?
Yeah.
This is the third one, yellow one. Okay, so the answer is B. Now, same material, fourth question. The purpose of the notice is to explain to occupational therapists that, what are the hedging words?
Purpose.
Purpose.
Yeah.
Purpose.
Purpose. Okay.
Occupational therapist. Main occupational therapist.
Okay. And if you know the type of,
Explain.
what are the different nature of the text? Notice by notice, you know, this is going to be the structure. So immediately, if you know that, occupational therapist, explain to occupational therapist. Option A, confirmation of equipment is subject to availability at the time of request. Availability at the time of request. Availability. Just you can highlight availability also is cool. Okay. Mattresses are of standard size, so may not be suitable for all bed types.
Not suitable for all bed types, no.
Not absolute.
Not absolute. And if they use technique, I told you,
Negative.
most probably that is the right answer.
That will be the
Answer, yes.
If they use this technique in any options, normally, I don't know, we'll confirm it. Normally, that is the right answer. This is the trick they play. Then once you know the trick, you know, as soon as they play, you counter play. Okay. Option C, patient factors must be considered prior to lodging a request form. Patient factors. Patient factors. Okay, must be considered. Now just read. Please read someone.
Equipment request form for pressure care mattress. It is the responsibility of the occupational therapist attending to the individual patient to submit an equipment request form based on equipment eligibility criteria. A pressure mattress may be...
One sec. Excuse me. The topic sentence says the request forms must be submitted based on equipment eligibility criteria, not patient factors.
Yeah.
If you have that competency to understand, it is not the patient factors that is considered, but equipment eligibility. Equipment is already there. See, they are not producing it when you order, right? Okay. So if at all you can understand that language, immediately you have a clue there. Let's see. Go on.
A pressure mattress may be appropriate when someone is at risk of a pressure injury as evidenced by documented sound clinical reasoning, and their pressure injury risk is unlikely to significantly change. Environmental and equipment consideration must be confirmed such as that a patient weight is within the safe workload of the equipment requested. The size of the mattress must also be compatible with the other bed equipment and accessories, and the patient has been informed regarding the contraindication of placing items. Example, continence product, sheepskins, electric blanket, ill-fitting bed sheet. On top of the mattress, only after this confirmation should be an ERF be submitted.
Okay. Where is the answer?
I think it's B, mattress, because they are talking about the mattress, not patient factors.
It is purpose, it is just based.
Yes.
Responsible
for the individual to submit an equipment request. Eligibility criteria. Pressure mattress may be The size of the mattress must also be
compatible with the other bed equipments, accessories.
No, if you say second one, mattresses are of standard size, so may not be suitable for all bed types.
Hmm.
Where do you have
Some
that
bed
answer?
type is suitable.
Inappropriate, Father. Maybe appropriate for
When someone is
such
at
as the
risk of,
patient
third,
weight
fourth
within
line. Fourth line, Father.
yeah, a pressure mattress may be appropriate when someone is at risk of a pressure injury as evidenced by documented and sound clinical reasoning, and their pressure injury risk is unlikely to significantly change. That doesn't mean mattresses are of standard size, no? May not, doesn't say so, may not be suitable for all bed types.
Father, the last fourth
size
line,
of-
the size of the mattress must also be compatible with other bed equipment.
Father,
and
may be
accessories.
appropriate when someone is at risk. The fourth line.
No, that's
The
saying
size
when
of the
someone is a risk, that is appropriate, but that doesn't mean it is not suitable for all bed types, right?
The
But
size
the
of
size of the mattress must
Size of the mattress also be
compatible and other bed equipment.
Answer based on topic sentence.
Yeah, the size of the mattress
must
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 be
also be
also be compatible with other
compatible
bed equipment and also accessories.
Yes.
Means mattresses are already fixed types. Okay, you have a list of mattresses, the size, the length, width, everything. So before you give ERF, equipment request form, you must confirm this fits to this circumstance or this patient or the other accessories with the patient.
Confirmation equipment.
The
Option
first,
is answer.
yeah, based on equipment eligibility criteria in the topic sentence means equipment eligibility criteria means that is fixed. You are going to decide based on it. Mattresses are of this particular standard size. You cannot do anything. Which size fits your patient, you have to confirm. Then give it the equipment request form. That's only language competency which you will gradually receive. Okay. You will receive, no problem. That will develop as you go on. Okay. So all bed types, that's not negative. The second, the C is patient eligibility criteria. B speaks about equipment eligibility criteria.
Equipment.
Yeah, only after this confirmation. What confirmation? Equipment eligibility is confirmed, then you place the PF. Okay, that don't worry. That's because of that's here I wanted to say all is not absolute.
Absolute.
Yeah, one example I wanted to give you. Maybe one more, we'll go fast. Number 5, all these are from same material, okay? Everywhere there is an absolute, either exception or otherwise. The memo about the use of smartphones during surgery tells staff that their use may be a violation of patient confidentiality. So this is a memo. If you know the nature of the text, immediately you find the answer. Then,
Okay, sorry, what's the answer? The previous one, what's the answer?
B.
B.
Okay.
Yeah, about the use of smartphones. Use of
smartphones during surgery.
During surgery.
Yeah, during surgery. What does it say about the use of smartphones? Their use may be a violation of patient confidentiality.
Violation of patient confidentiality.
Patient confidentiality.
It's a concept violation. They are to be used only by
Only
absolute.
Will you agree? Nurses will agree that they are to be used only by surgeon.
No.
Other assistant doctors will object, right? So you can eliminate.
Yeah.
Then they can potentially lead to patient harm.
Potentially.
Patient harm.
Potentially harm. Yes.
Yes. Potentially harm.
Yes. At least one is eliminated based on the
Absolute.
Absolute.
Again, it is made easier. So just read fast.
Memo restricted use of smartphones during surgery. As smartphone technology has become increasingly common, it is now a cause for concern when used within the operating rooms, especially as a major source of distraction. For this reason, the use of smartphones within the operating rooms will now be restricted. The undisciplined use of smartphones, whether for telephone, email, or data communication, and whether by the surgeon or other members of the surgical team, may compromise patient care. Whenever possible, members of the operating suite team should only engage in urgent outside communication during surgery. Personal and routine calls should be minimized and kept as brief as possible. Incoming calls should be forwarded to voicemail or to be reception desk to be communicated promptly. Any use of a device or its accessories must not compromise the integrity of the sterile field, and special care should be taken to avoid sensitive communications within the hearing of awake or sedated patients.
Okay. Now you have to choose between A and C.
Patient confidentiality. A. The choose.
C.
C.
Patient harm.
Any use of device or its accessories must be
especially
compromised
as
the
a major
sterility.
source of distraction.
Distraction. Major source of
Distraction means
distraction.
will be patient harm.
Patient harm.
May the topic sentence is especially
Major source of distraction.
distraction. Okay. Then
For this reason, the use of smartphone within the operating rooms will now be restricted.
Yeah, that is the reason. So which is the answer?
C.
C. Potentially lead to patient harm.
Yes.
They can potentially lead to, maybe they can potentially, probably.
And the last paragraph, any use of device or accessories must be compromised the integrity of the sterility compromising.
Yeah. All this, then rest of the paragraph explains the topic sentence. If you have studied the paragraph structure, I have uploaded episodes. Now, first tip is about paragraph structure. If the topic sentence speaks, that is the topic of the paragraph. That topic sentence will be explained by the supporting sentence or sentences. That will be illustrated by examples, evidences by developing sentences. Okay.
But there also the second paragraph, third sentence,
may
compromise patient care.
Yes,
yeah.
Father.
Yeah.
May compromise.
May compromise. That
May
I did not take it
compromise.
because I did not take it because earlier I said if there is a what is that modal verb that tells you that is the answer. That's another strategy. I am not stressing on it. I am just
Modal verbs. Okay.
I'm stressing on absolutes now. See, in this also you have one absolute. Every question you had absolutes, right? So it makes easier. Second one we eliminated. B we eliminated based on only.
Only.
Yeah. Okay. Do you have stamina to go for one more question?
Yes, Father.
Yes, Father.
Yeah. The sixth one. The main point of the extract on subcutaneous cannulas is to explain. Main point.
Main point.
Main point.
Subcutaneous cannula.
Subcutaneous cannula.
Okay. I'm not highlighting, okay, because my system is not responding fast. Okay. You can highlight in your mind, or if you hard copy in that. You have to take the hard copy of the same materials. Okay. Then you have to practice by yourself and explain and convince yourself. Option A, the versatility of their design and function. Design
and function.
Design and function.
Okay. Then option B, that they must only be used by registered nurses.
Only
Doctors should never use it. Doctors should never use it. Not registered nurses should never use. Only registered nurses must use. Do you agree?
no.
That's absolute, right? This is absolute, right?
Yes.
Yes.
So if it is absolute,
Remaining
elimination.
is
Just to show you that this material, all the questions have one or two absolutes, which makes it far easier. Okay. So option C, the need for a backup cannula in case of malfunction. Now there is a word explain. If you know the paragraph structure, that tells you where is the answer. Explanation. Let's see. Now, paragraph, if you know the paragraph structure, you know?
Yeah. First
the most important information, supporting details. Okay. Just to give you an idea. Okay. That's why I said, unless you watch episodes step by one, at least those who are here, watch each episode, whether it is relevant or not relevant, don't worry. Now, structure analysis approach you have to use in such places. Topic sentence, most important information, first sentence. Then important information, supporting sentence explains the topic sentence. Then less important means developing sentence gives evidence or examples or illustrations. Then conclusion. Okay. This I have clearly explained in the peel approach as well.
Peel approach.
Peel means peel the paragraph. P stands for
Point.
Explain.
Point. Explanation.
Evidence.
Sample.
Link. Yeah. The main point, design and function, only the need for a backup cannula. Now you see the topic sentence says subcutaneous cannula is a small plastic tube designed to carry medication into a person's body.
Designed.
Design and function is to carry the medication. If you understand the language, if you have competency, there itself you have the answer.
Yeah. Yes, thanks.
The main point means the topics. Main point means here they are asking the main point, right?
Yes, Father.
Main point must be in the topic sentence.
Topic sentence.
Then you know, as soon as you highlight the main point, you know, go to the first sentence and find the answer. And second one is already deleted because absolute is there. Okay.
Yes.
Design and carry medication to a person's body is the function.
Function.
Of subcutaneous cannula.
Listen.
Okay. Cool. So the answer is
A.
A. As easy as that. Okay. Too much for you. That's why I said you should know every bit of it. Next semester, I think we will see the steps and model verbs. You must be, the topic sentence is the main point, main information. Yes. How do you find it? I have prayer at 7 o'clock, so you have 5 more minutes. I did not select anything. The sequence, in the sequence, I have taken those materials. And you find in all the 5 there are absolutes.
Hello, Father.
Thank you so much, Father.
If the topic said that, if the question said that the main purpose and the main idea of the extract, both questions, they are the same thing, right?
Yeah, main idea, main purpose, gist, everything is same. Topic sentence is the gist of the paragraph. Topic sentence contains the main point of the paragraph. Topic content is the main idea of the paragraph. All these are synonymous. In IELTS, you have to find the questions. You will have to find the headings for about 6 texts. So if you know what is the topic sentence, heading is there. You have to choose the headings. So topic sentence or the summary or a paraphrasing or a short form of the topic sentence will be the heading. Within no time, 6 questions are answered within fraction of seconds. Same thing. They are asking in a different way here. That's all. In IELTS, you have paragraph and paragraph heading matching. Here you have in the question, all these are same. So what you can do, if at all our sessions have to continue, I said last time around 8 of them agreed, but only Lini Kurian, I think somebody, Lini Varghese started a WhatsApp group. I said to motivate people, you can start a WhatsApp group and add me as well. Then don't add the people, those who are not active from the platform, but some others you can add, those who want to study. Then what happens? Some of them are not in Telegram. They do not know how to handle Telegram. Some are frightened to download Telegram. So you can guide them, maybe 5 of them. You can post, I can help you to post episodes one by one so that easily they can learn. At the same time, you will have a clarity as well as you lead them. So you can have a personal WhatsApp group. You know how to make a WhatsApp group, right? Create a WhatsApp group. For the time being, you can add me as well until you get there. Then it will be a heavy burden for me until I guide you what is to be done. For example, only Lini Varghese did it same day. Okay. So she could reach to some people. That's why we have newcomers today. Please go more class. That's what I'm telling now. Everybody go to the platform and tell them it's going to be useful. Please attend. And also tell them there are, okay, everybody will post this information, okay? In all the subgroups and main group. Main group, we can post anything other than links. Links are allowed only by chief admins, 2 admins, you know, Anita and Anjali. And nobody else can post, but you can post these messages. And 20, 21, 22nd, inform that there are less number of people, so may not have the seminar. If there are more people, we will have. We have very few people. They are also not available all the days. We had proposed a seminar. Mention that. At the same time, you give them a motivation and try to interact in the group, those who feel that you should continue, and make sure how many of them want to join. If one of you can find one at least who want to join seriously. Next 15 days, I have got my regular timetable, so I can make adjustments in the schedule anytime in the 24 hours. If you tell me immediately. Otherwise, I'll take up other sessions and I'll not be able to give you time because I have holidays in my campus. So next 15 days till January 5th, if you have at least a reasonable number, you can conduct any hour of the day. Even midnight, I don't mind. Okay. I am just closing the YouTube because I think there is